This next scenario we're going to be taking a look at is from a set of practice problems available on UBC's website. And I think this is great because you're going to be put in some awkward situations. They want to see how you respond when things get a little bit awkward. So you're going to have some experience with these awkward situations before you get into your interview, because there's a good chance you're going to have at least one of them. May as well know what to expect now. So in this scenario, you are going to be a doctor. So this is you over here. You are already a doctor, so you equal doctor. And you're in your office one day and a patient comes in, right? One of your patients comes in, but she comes in alone and she's also a 14-year-old girl. So automatically you assume what the hell's going to happen? She's going to say something weird. There's a reason she's here without her parents, right? So 14 years old. Now she's going to ask two things. First thing she's going to ask is for birth control pills. The second thing she's going to ask is that you don't tell her parents. What do you do? It's awkward, right? No matter how you want to look at it, this is an awkward situation. So what are you supposed to do in this case? The most important thing a doctor needs to do is make sure he is always acting in the best interest of the patients, right? You always want to make sure the best interest of the patients is always the first thing that's going to be looked at. Now, they also have to respect the patient autonomy. If your patient is making an informed decision or makes an informed request, as long as they understand the consequences or the parameters of that decision, they should be allowed to make that choice. As long as also they have to be educated. They have to understand, so that's another thing we'll look at when dealing with patients who cannot make a competent decision or who are not deemed competent. We'll deal with that at a different stage. But for now, we're dealing with a 14-year-old girl. So what do we do in this situation? Well, look at our pipeline, right? We go with our checklist we know. We start off with what's the problem, right? What's the problem or what's the decision, right? Do we give minor birth control pills without parental consent? Now, the two things to consider here, right? Acting in the best interest of your patient and respecting patient autonomy. So what can we do to accomplish both of those things? We want to make sure that we collect a lot of information, right? The second stage of the solution pipeline where we ask questions is going to be so important. You want to just sit there and ask questions for 3 minutes straight. I don't care if it takes up so much time that you have, that 3 minutes of the 8 minutes you have, just get all the information possible. You want to make sure that you cover absolutely everything so that the actor who's playing the role of this 14-year-old girl has pretty much given you all the information to assure you that you understand, that she understands what birth control entails. So let's start off, right? First question you ask. It's going to be awkward, but you need to ask this. Doctors ask this all the time to people. Are you or have you been sexually active? Seems like an awkward question, especially when you're saying it to a 14-year-old, but you have to look at this 14-year-old as any other patient, right? You have to treat her with respect. You have to ask these questions. You have to make sure that she's going to get the same care that any other adult would receive coming into your practice facility. So you ask her, are you or have you been sexually active, right? And hear about her past experiences and, mainly hear about whether or not she was safe during those situations. What types of contraceptives was she using, right? Next, you can go ahead and ask something along the lines of, let's just say this is her first time. Right? Say this is her first time. You ask that question. Nope, this is her first time. So she doesn't really know what's going on. Well, say, what do you know about safe sex? Everybody has sex ed, when they're, young. When you're young, you receive a sex ed course, right? Everything's awkward. You don't really know what's going on. But, you retain a little bit of information. But in some cases, you don't retain all the information. So there could be a few misconceptions. What do you know about safe sex, right? What does she think, the birth control pill is going to do? And that could be the next question you follow up right after this. What do you know about the birth control pill? Because generally, when somebody says they want the birth control pill, obviously there's going to be exceptions, but just generally, when somebody requests a birth control pill, it's because they plan on having unprotected sex, right? For the most part, especially if a 14-year-old is approaching you asking for the birth control pill, it's not very likely that they're just being extra safe. They're being one of the situations where they'll use a condom and they'll use the birth control pill. Normally, when someone's talking about the birth control pill, they want to have sex without a condom. It's just generally what happens. Normally, people who've been in a relationship and they know that both sides do not have any STDs. So, ask her what she knows about safe sex, right? What does she know about, the two main things you're looking out for when you're talking about sex is, making sure you don't get pregnant if you don't want to get pregnant, or managing your pregnancy, and avoiding STDs, right? Those are the two things. So while the birth control pill will be successful in removing the pregnancy part of that scare, it's not going to reduce or remove the STD part, right? So she needs to make sure that she understands what the birth control pill is. Now, if she says she understands what the birth control pill is and she understands what safe sex is, so she plans to use the pill and the condom, she just wants to be extra safe, you should commend her on being knowledgeable of what's going on and having an idea of what she should do, right? She's not just going in and she's gonna have unprotected sex. She's actually going to just be extra safe, which is why she came to approach you. And you should treat her as an adult and say it's very mature of you to want to be this safe. Next thing you want to say is, you can't really give her something or, prescribe her something if she doesn't really know what it is, right? So you say, do you know about the side effects of the birth control pills? Do you know about birth control pill side effects? I'll write SE here, right? Because we know that the birth control pill, it typically makes women increase in weight while they're on it. I know that's a common side effect. I think there's mood swings as well related to it. So it's just another thing to consider. Does she know these things, right? Does she know, she might have read some things up on the internet. You want to make sure that she actually understands what they are correctly, because there's obviously, a lot of, everyone can write anything on the internet. You want to make sure she's got the proper information. And the same will go for everything else over here. So if her reasoning behind, why she wants this is based on, what she read on the internet, make sure she has the correct facts behind it. So these are a bunch of great questions we asked, right? We collected a bunch of information. Now, a fifth question you can ask, right? I mean, you are looking out for the best interests of this person. You don't want to get too involved in their personal life. You don't want to, but you can ask this last question down here. Why don't you want your parents to know? Why don't you want your parents? You want your parents to know. Here, reasoning why she doesn't want them to know, right? You can tell her, I am still going to allow you to have these pills, right? Because you've shown me that you are educated in your decision, or we have talked this over, and after I've given you all the information, you understood the limitations and the consequences or the side effects, and you still want them. But what's the reason why you don't want your parents to know, right? Hear her reasoning out. You're there to help her out in her case if she needs. So, hear her reasoning, but you're still going to give it to her, even if she doesn't give you, she doesn't want to talk about it, right? So this is like an optional question down here that you can also ask, but not mandatory at all. So now we come down to, stating what the problem is, right? The problem, you can go ahead and actually state out loud. You can restate it. Is that I need to know if I should give you birth control pills without your parents' consent. So do I give you birth control pills without your parents' consent? Now, in most cases, right, what would be the issue of the parent, right? Because I want to remove religious reasonings of the parent from this situation, right? Because if the child had the same religious beliefs as the parent, they probably will not be here asking for that. So that's one thing to, you can bring that up in the questions if you want to discuss that. But for the most part, I want to just think, what's the main concern of a parent? And that's going to be, is the kid safe, right? So when we're talking about satisfying both parties in terms of solving a problem, normally to appease both sides, you want both sides to be happy. The main concern of most parents is going to be, is the kid kid safe? Is my children safe? Are my children being safe? And if we make sure that they know all the dangers and the limitations that we asked up here in the questions part, well, I think we should be safe in answering that question, which is yes, they will be safe. So what are our options available over here, right? Option number 1, don't give her the pills. Don't give her the pills. Option number 2, so our solution number 2, give her the pills. Give her the pills without asking questions. Give her the pills without asking questions, or inform her of the dangers, limitations of the birth control pill before giving it to her. Giving her the prescription. There we go. So these are the 3 main pathways we have. So don't give it to her. Don't give her the pills. Say don't give her the pills without parental consent. Give her the pills without asking anything, and then inform her of the dangers. It's pretty clear which the correct answer is over here, right? I mean, we can go ahead now. This is where we go ahead and actually pick which one we want. What's the problem with this pathway over here? No respect for patient autonomy. There's absolutely no respect to patient autonomy over here. Not looking out for the best interests of the patient for just giving her the pills blindly. Not looking out for patient's best interests. Because this over here, you're just going to give her the pills. And remember what I said, right? If somebody's asking for birth control pills, more times than not, the reason why is because they want to have unprotected sex and they don't want to use a condom. Now, remember, that will help you. The pills will help you with the pregnancy part, but not with the STD part. So it's highly recommended that if you plan to have unprotected sex using the birth control pill, you'll also have, both participants will have been checked out to make sure they don't have any sexually transmitted diseases, right? So you have to get rid of that idea of just giving her the pills, right? So this one does not respect her autonomy because you're not requesting you're accepting a wish, but just blindly accepting her wish or her request is also not a good option. So it's pretty clear that the good option or the best answer for this scenario is to educate her, and with the education, then if she still wants it after the education, then you allow her to have the pills, right? So this is going to be respecting autonomy. Respecting patient autonomy while looking out for the best interests. Now you're going to want to, go ahead and say what the plan of action is, right? So the plan of action is, I'll give you all this literature. You don't have to, you don't have to give her the pills right now, right? You can actually give her a bunch of information regarding birth control, so she can go read it up, or you can suggest certain websites that have accurate information. So give her information regarding safe sex and birth control. A bit more space here. Potentially give her time to think about it. And then after, if she still wants the pills, after being informed, give them. And as always, we want to make sure that the patient is happy with the care that we provided. Sorry, this is the sample questions over here. It's the one where I got it from up here. Give them, after being informed, give them and then ask her if that's okay. Is this okay? To actually ask that to the interviewer and make sure that they are happy with the approach that you got. So that's how I would approach this situation. It's a very weird situation. It's a difficult situation. You have to consider two things, right? You're balancing, the best interest of your patient and patient autonomy. The two things that you need to really consider. And we're going to see a lot of cases in this series that are going to look out for making sure that we're always looking out for these two things and trying to balance them out, right? It's two difficult things to balance out. If we can do it successfully, we're going to have a great interview. So if you have any questions regarding this case, leave them below, and I'll see you in the next case in the next video.